It's my privilege to introduce our Health of the Region report. A really important report because it shines a very sharp light on the health inequalities that exist across the region. And regrettably, COVID-19 has actually exposed those inequalities and has deepened them.
Health inequalities are a real issue within the West Midlands. Inequalities relate to where we live, how we live our lives, and also access to a range of services to support our health. Preventable causes such as cardiovascular disease, respiratory conditions, liver disease, cancer, as well as infant mortality rates have been much higher. We've also had higher rates of drinking, obesity, and physical inactivities, as well as people not taking up the opportunity for cancer screening. But this is all in the backdrop of the greater levels of deprivation in the West Midlands.
So there are a number of things that are happening that means that Black and minority ethnic people are more likely to contract the disease and to die from the disease. The first thing is that Black and minority ethnic people are more likely to have jobs and roles, which mean that they're on the front line. The second thing that's happening is that you're more likely to live in areas where you're deprived, more likely to have more people living in the same house. We also need to recognise how issues of racism impact on communities as well.
What the pandemic has highlighted is the amazing call to action from our diverse faith communities. Places of worship came together to prepare food and serve food together. We saw clothes banks as well as the food banks growing and developing in the region. The role of communities for action on health inequalities is very important.
We've identified 4 key challenge areas that the combined authority and our regional partners have come up with more than 50 commitments to address these. The first challenge is around improving outcomes for our Black, Asian, and minority ethnic communities. Our second challenge is around tackling the wider determinants of health. This means getting a good start in life, educational attainment, our jobs and income, our homes and where we live, and the friendships and the sense of purpose we all require. The third challenge area is around widening access to health and care. Fourth challenge is around people-powered health. By people-powered health, we mean people more involved in their health and care.
So the first recommendation, we would want the government to work with partners to take action on race disparities and associated risk factors. Secondly, the government should double the proportion of health and social care spending to focus on prevention and public health. And then the third recommendation, again, the government should do all it can to close the gap in primary care provision between the most and the least deprived neighbourhoods. And then the fourth recommendation, government should invest in the West Midlands Combined Authorities Radical Health Prevention Fund. We do need to take steps to ensure a happier, healthier, more resilient population to future pandemics.
Let us make sure that this event does not pass without us really leaning in to some of the underlying issues.